Hello, everyone, and welcome to the March session of our ongoing webinar series. This one is Healthcare Considerations for Your Financial Plan. My name is Tom Bittinger. I'm with the marketing team here at Wealth Enhancement Group. And before we get started, I just want to go over a few quick housekeeping items. One, there will be a Q&A session at the end of this presentation, so please feel free to use the questions pane on the side of your GoToWebinar menu. We'll get to as many as we can at the end, but we have a lot to cover, so no guarantees on however many we'll get to, but anything we don't answer, we will forward on to your advisor and they should be able to reach out to you individually. Also, there is going to be a replay of today's webinar available soon. We are recording today's session, so look for that in your inbox shortly. If you don't see it or miss an email or something, it will also be posted to our YouTube channel, so be sure to check that out as well. Today's presenter is Chloé Briel. She is an advanced planning manager and senior financial planner here at Wealth Enhancement Group. Chloé, we got a lot to get into, so take it away.
Thanks for the intro, Tom. And I promise that wasn't my evil twin on the last slide. I recently went from blonde to brunette. That is me, and this is me as well. Retirement healthcare costs can be daunting. I believe it's critical to include healthcare in your financial plan. Major medical expenses and/or care needs can change the course of your retirement. When thinking about your health and how it pertains to your retirement, it's important to first consider your lifespan. A study from the Society of Actuaries found that 43% of adults underestimate the average life expectancy by about 5 years. This means that a huge number of adults actually think they're going to pass earlier than statistics indicate. The average person's life expectancy after reaching age 65 is approximately 82 years for men and a little over 84 years for women. Additionally, 25% of people who reach age 65 will live past age 90, and a full 10% will live past age 95. Consider a scenario in your financial plan assuming you'll live a long life. And in that scenario, consider the type of life you want to live in those extra years. That leads us to our next topic, health span. Health span is a term that refers to the amount of time you can expect to be healthy, whatever your definition of healthy may be. Obviously, everyone is different, so someone with underlying issues or chronic illness will have a different definition than someone without. If you're a 65-year-old man and your life expectancy is approximately age 82, how many of those 17 years, the difference between your current age and life expectancy, can you expect to be active and healthy? For example, let's say that number is 7. That means there's a 10-year difference between health span and lifespan. During those years in which you may not be healthy and may require significant health care or even need long-term care, what happens to your financial plan? The potential costs of healthcare and insurance in retirement can be jarring if you're not prepared. One survey by Employee Benefit Research Institute found that over a quarter of retirees say their health and medical insurance costs in retirement are higher than they expected them to be before they were retired. Even if you're on top of your current healthcare expenses, this chart shows that costs have risen steadily during the past 20 years, from just over $1 trillion in 1995 to $4.3 trillion in 2021. To put overall healthcare costs in a better perspective, this chart compares the cost of healthcare with the Consumer Price Index, which is the federal government's method of measuring inflation. The blue line plots what $1 trillion would have risen to if healthcare costs had risen at the same rate as the Consumer Price Index. The green line shows the actual rise in healthcare costs. Will the current trend of rising healthcare costs continues in the future? Of course, I don't know the answer to that. But if history tells us anything, paying for healthcare needs to be a major consideration as you age. So how can you go about incorporating healthcare in your financial plan? Today we will cover bridging the gap between retirement and Medicare, navigating Medicare, planning for long-term care, and creating or updating critical estate documents. Bridging the gap. Depending on when you retire, you may need to find a private health insurance policy to cover the gap until you reach Medicare at age 65. According to recent data, the average retirement age in the US is 62, and this average age has remained the same for the last decade. Since most are not eligible for Medicare until turning age 65, the average retiree in America has 3 years between retirement and being eligible to sign up for Medicare. Now that we know this gap may exist, what can you do? There are different ways and combinations to cover the gap until you're eligible for Medicare. Today we will discuss how and when to use a health savings account, group retiree coverage, COBRA, and/or individual coverage via a health insurance exchange. To contribute to an HSA, you must be enrolled in a high deductible health plan and not be claimed as dependent on someone else's tax return. While HSAs are designed for healthcare expenses, their true potential shines when they're also used as a retirement savings tool. If you have a current HSA or plan to utilize an HSA, consider letting the funds grow within your HSA while using cash flow to cover your medical expenses prior to retirement. By keeping the funds within your HSA, you can take advantage of additional tax-deferred growth. Contributions to HSAs are made pre-tax, which directly reduces your taxable income. These funds aren't taxed when they're in the HSA or when they're withdrawn for qualified medical expenses, providing a triple tax advantage. And you own the HSA, not your employer. The HSA is yours to keep for life. You could also consider using your HSA to have additional flexibility in retirement. HSA funds can be withdrawn tax-free at any time for qualified medical expenses, or if you wait until age 65, funds can be withdrawn to cover non-medical retirement expenses without penalty. If you use the funds for non-medical expenses after age 65, the funds will still be subject to income tax, but again, would be penalty-free. Some of you may have access to group retiree coverage. Some employers or unions continue to offer healthcare coverage to employees even after they retire. Typically, it's the same plan you had pre-retirement, and employers may contribute to cover premiums. If you're lucky enough to have access to group retiree coverage, it's usually the easiest and most cost-effective way to go. However, it's important to note that while this sounds like a great option, it may not be an option at all. Not all employers offer retiree coverage, so you'll need to check with your benefits professional to make sure this is available to you before you rely on it. The Consolidated Omnibus Budget Reconciliation Act, or COBRA, gives workers and their families the right to keep their employer's group health plan after insurance coverage would generally end. This temporary medical insurance can be an option for those who are forced into early retirement, face an unexpected job loss, or have a death in an immediate one's family. A potential downside to this form of coverage is that you'll likely see a significant spike in premiums, as you would be required to pay the entire premium, which could be up to 102% of the plan's cost. This option may make sense for those who really like their current plan or want to keep specific in-network providers and couldn't find a comparable option on the exchange. It is also possible that COBRA may not be available to you. If you work with a small employer, for this discussion, COBRA considers this to mean less than 20 employees. It may not be an available option. Also keep in mind that COBRA insurance is only guaranteed for 18 months, and in some cases up to 36 months. Even if you utilize COBRA coverage, there could be remaining gaps from when COBRA ends and Medicare availability begins at age 65. The last option we'll cover today is individual coverage. Under the Affordable Care Act, regardless of pre-existing conditions, anyone can purchase a policy from the state, or if your state doesn't have its own exchange, the federal health insurance marketplace, where you can comparison shop health insurance. The options available and premiums will depend on where you live, and which level of coverage you choose, the cost of which may approach or even exceed $800 per month per person. But depending on the cost of insurance, you may qualify for financial help in the form of tax credits. In 2023 through 2025, there is no income cap to qualify for tax credits towards private health plans, as long as the cost of a mid-level silver plan premium exceeds 8.5% of your modified adjusted gross income. If you're considering this route, it's well worth it to plan ahead. If you have the flexibility, consider aiming for reduced income during the years in which you're enrolled in the exchange for lower premium costs. The next thing we'll discuss is a high-level overview of how to navigate the different parts of Medicare coverage. Medicare is our country's health insurance program for people age 65 and older. It can be complex, and without proper guidance, can lead to misconceptions and gaps in benefits. A clear understanding of exactly what Medicare covers, and perhaps more importantly, what it may not cover, can help you better plan for your healthcare in retirement. Some retirees may select Original Medicare, which includes Part A and Part B, but others may find Original Medicare is lacking for their situation and may decide to supplement with Part C, Part D, or Medigap coverage. In some cases, that may mean paying additional premiums for this additional coverage. But first things first, let's go over enrollment, because one of the most important parts about enrolling in Medicare is when you enroll. The overwhelming majority of you will enroll in what's called the initial enrollment period, which is the period of 3 months before you turn 65, the month of your 65th birthday, and then 3 months after you turn age 65. This period encompasses the 7-month window for the initial enrollment period. It is recommended to sign up 3 months prior to your 65th birthday to avoid delays in coverage. If you miss out on enrolling during the initial enrollment period, your next opportunity is likely during the general enrollment period. The general enrollment period happens every year and lasts from January 1st to March 31st, with coverage starting the first month after you sign up during this period. If you miss this window, you must wait until the following year's general enrollment period and may pay late enrollment penalties. Reviewing your Medicare coverage once enrolled is also an important part. Coverage does not need to be a set it and forget it. There are open enrollment periods annually in which you can switch coverage. Finally, there are some special circumstances that would allow you to enroll after the initial enrollment period and outside of the general enrollment period. The special enrollment period is only available for a limited time, as its name implies, and for certain situations. There's a list of these special circumstances on the Medicare website, so if you think you may be eligible, I urge you to check it out and discuss it with your advisor. Lastly, if you miss the window when signing up when you're eligible during a special enrollment period, you'll have to wait for the next general enrollment period and again may have to pay a late enrollment penalty. Now that we've covered the basics of enrollment, let's dig into the nuances of each part of coverage. There's a common perception that once someone is eligible for Medicare, healthcare costs are eliminated. The good news is that Part A, which is hospital insurance coverage, is provided to most people, about 99% of Medicare beneficiaries, according to the Medicare website, without a premium payment. Part A would be premium-free for those who have worked or had a spouse who worked at least 10 years and paid Medicare taxes during those 10 years. As noted in the chart, there are deductibles and co-payments for the services received. This chart reflects the 2025 amounts. Even if you're still working and covered by an employer-provided health insurance plan, if you're age 65 or older, consider enrolling in Medicare Part A if it's premium-free for you. If you have both coverages, the employer plan generally pays first, and then Medicare would become the secondary payer, hopefully reducing any out-of-pocket costs you may have. You will want to work with your benefits administrator to see if this coverage could apply to you. If you do have to buy Part A and it's not premium free, and you don't buy it when you're first eligible for Medicare, your monthly premiums may increase by 10%. Medicare Part B is used to cover medically necessary services like doctor and outpatient care and preventative services. Benefits could include doctor's visits, outpatient visits, diagnostic tests, and outpatient therapy. Generally, you enroll in Medicare Part B when you enroll in Part A, unless you are still covered by your own or your spouse's employer group medical plan. If you miss the initial enrollment period for Part B, then you will either need to qualify for special enrollment or you must wait until the next general enrollment period. However, if you don't enroll when you're first eligible and do not have alternative coverage, premiums will increase by 10% for each 12 months until you enroll. So if you mistakenly miss enrollment for a full 5 years, your premiums will increase by 50%, and the premium late enrollment penalty is permanent. Unlike Part A, Part B premiums vary annually depending on your income, and it's on a sliding scale. The standard monthly premium for Medicare Part B enrollees for 2025 is $185 per month. This means that regardless of income, Part B beneficiaries will pay at least the standard Part B premium of $185 per month in 2025. How much you pay above and beyond that $185 per month is again dependent on your income, with the highest monthly premium being over $600 per person per month. The monthly adjustment amount, sometimes called IRMA, reflects applicable fees due to higher modified adjusted gross income. The total monthly premium column reflects the base $185 per month premium, as well as any income-related adjustments. You will be notified by Social Security via mail if a monthly adjustment amount applies in your situation. There are some financial planning strategies you can implement to try to lower your Part B premiums. Premiums for Part B are means tested, which means monthly premiums are based on your income. If you're not aware, your Medicare Part B premiums are based on your modified adjusted gross income from 2 years prior, and the Social Security Administration adjusts the fees annually based on your federal tax returns, which are automatically provided to them by the IRS. This means that planning starts now for future premiums. Your financial advisor can help you consider if the following work in your financial plan. You could consider completing Roth conversions now, which would reduce IRA balances and therefore reduce future required minimum distributions that could push your income and therefore Part B premiums higher. You will want to be very mindful of the amount of conversions, as they could push your modified adjusted gross income over a premium threshold, the opposite of what we're trying to do. Another way to reduce your income is to consider ways to reduce investment income. In taxable accounts, you can work with your financial advisor to consider things such as ways to reduce capital gains distributions and ongoing tax loss harvesting. Another way to potentially reduce your modified adjusted gross income is to maximize IRA, 401k, or HSA pre-tax contributions, assuming you have access to these accounts and earned income. You can also determine if using HSA funds to pay for Part B premiums fit well into your retirement strategy. Part C coverage is also called Medicare Advantage. These plans are offered by private companies that contract with Medicare. These plans must cover all medically necessary services that original Medicare, which again is Part A and Part B, cover, and some plans may also offer extra benefits. And Part D is also included in most Advantage plans. Part C plans can be a good fit for those that need their coverage to be tailored to support certain health conditions, and can also offer benefits such as access to clinical trials, which is not covered under Parts A and B. But you may need a referral to see a specialist, and in many cases, you can only use physicians and providers who are in network. You can enroll in Parts A and B, or you'll enroll in Part C, but not both. If you enroll in Part C, you'll pay the monthly Part B premium and may also have to pay the plan's premium. Some plans have zero premiums and may help pay all or part of your Part B premium. Unlike original Medicare, where there's no yearly limit on what you pay out of pocket unless you have supplemental coverage, Medicare Advantage plans do have a yearly limit on what you pay for covered Part A and Part B services. Once you reach Part C's plan limit, you'll pay nothing for covered services for the rest of the year. Part C plans have varying types, varying out-of-pocket costs, varying premiums, and varying benefits, and they're actually based on the county of residence. And the in-network provider pool in Medicare Advantage plans may be smaller than those that are offered in original Medicare. There are many details to consider when deciding between original Medicare and Medicare Advantage plans, and you'll want to review your options carefully. Part D Medicare drug coverage is optional, but it is available to everyone with Medicare. Coverage can be purchased through a Medicare Advantage plan, as we just discussed, or through a standalone Part D plan. Each plan varies in premium cost and specific drugs covered. As of this year, Medicare Part D enrollees now benefit from a new $2,000 cap on out-of-pocket prescription drug costs. That includes any deductibles, copays, and coinsurance, but not premiums. This change was part of the Inflation Reduction Act of 2022. And once you reach that $2,000 limit, the plan will cover 100% of the cost of covered medications for the rest of the plan year. Also, even if you don't take any prescription drugs now, consider signing up for Part D as soon as you're able. The Part D late enrollment penalty is calculated by an extra 1% for each month, so 12% a year. If you miss all 12 months, you are eligible to join Medicare drug coverage and didn't have any other credible prescription drug coverage. This monthly penalty is added as long as you have Medicare drug coverage, even if you switch to a different Part D plan. If your circumstances and/or medication needs change, you have the ability to change your Part D plan coverage annually during the open enrollment period, which is usually from October 15th to December 7th. Everyone needs a plan for their long-term care. According to the U.S. Department of Health and Human Services, an average of 70% of people 65 and older will need long-term care at some point in their lives. Many people choose long-term care insurance as part of their long-term care plan, but most don't. According to the Institute of Aging, 65% of those needing care will rely exclusively on family and friends to provide assistance. To get a better understanding of long-term care and how it works, and to consider what you can do to prepare financially, we need to examine 3 key questions. What is long-term care? How much does it cost? And what options do you have for funding potential long-term care expenses? Long-term care can involve a variety of services designed to meet the needs of each individual and caregiver, and can include non-medical care. It can include skilled nursing care, such as the rehab care needed after an extended hospital stay. Long-term care can also include community and residential care, such as senior centers and assisted living facilities. These are environments that can be for individuals who can no longer function independently, but don't really need daily care or wish to just have a more vibrant social life. Or they can include things such as housekeeping, personal care, and medical services. It can also include home-based care, which can be informal, occasional help with the activities of daily living, or things such as help with meals, budgeting, house cleaning, medication management, or even transportation. It can also be care offered by formal and paid professionals who come to your home on a regular basis. All of these services can help you or a loved one age in place. Long-term care even includes respite care, which is short-term relief for primary caregivers. Respite care may last anywhere from a few hours to several weeks at a time. and respite care can take place at home, in a healthcare facility, or an adult daycare center. Now that we know what long-term care can be, let's look, on average, at the monthly care costs. Long-term care costs vary by state and region, and it can get very expensive very quickly. So, going back to our health span versus lifespan discussion, if you lived in a private room in a nursing home in the US for 5 years, on average, you'd be spending nearly $600,000 on just room and board during that period. No one enjoys discussing end-of-life issues. I get it. But consider the peace of mind that long-term care planning could provide to you and your loved ones. Self-insuring involves depending on personal savings and investments to fund any long-term care needs. This choice would give you increased flexibility, but may require additional and thorough preparation. Ironically, self-insuring often is the default, simply because of lack of planning. Self-insuring may work for your situation, but it does come with some considerations. Self-insuring may have an impact on your overall retirement strategy. This chart shows a $1 million investment portfolio generating a hypothetical 5% rate of return. It assumes a 65-year-old couple will be withdrawing $50,000 per year, adjusted upward 3% each year to account for inflation. Based on our hypothetical illustration, this investment portfolio has the potential to provide income at their desired level until the couple reaches age 88. If, however, one spouse spends the first 5 years of their retirement in a nursing home with cost based on the historical averages, the portfolio's trajectory changes. In the long-term care expense example, which is the lower line, it reflects an expense of $117,000 a year, again, adjusted annually for inflation, for the first 5 years during which the spouse requires long-term care. As you can see, if they make no changes and income needs remain the same, the hypothetical portfolio would be exhausted by the time they reach age 80. One question that naturally arises is, what about Medicare? Does it help with long-term care services? Medicare may offer a partial solution to the long-term care needs, but it doesn't pay for long-term care needs that are deemed non-medical. Most nursing home care is considered custodial care, in which help is provided for one or more of the activities of daily living, like bathing and dressing. Original Medicare may cover skilled care at a nursing home or in your home only if the need is short-term and temporary, and it assumes that you're getting rehab or medical treatments after a hospitalization for an illness or injury. Under certain conditions, Medicare will cover the first 20 days of skilled care completely. For care on days 21 through 100, Medicare pays all but a daily coinsurance, but after 100 days of care, original Medicare doesn't cover any remaining cost. And if you meet this criteria, you would still need to begin the search to find a facility that accepts Medicare in your area and then meet all the other conditions that Medicare imposes for this type of coverage. Another choice is to transfer the financial risk of long-term care to an insurance company through the use of long-term care insurance policy. A long-term care policy can cover all levels of care, from skilled care to custodial care to in-home assistance, as well as protect your assets so they may continue to be used for charitable and legacy planning needs. Although an insurance policy would obviously require a premium, the premium cost could end up being a small percentage of the out-of-pocket expenses you would otherwise have to pay if you need to find yourself needing extended care. Also, you could consider utilizing your health savings account to pay your annual long-term care premiums. Some states, like Minnesota, offer tax credits for long-term care premiums paid, depending on income and age. Additionally, qualified long-term care premiums can qualify for the medical expense itemized deduction if total medical and dental expenses exceed 7.5% of your adjusted gross income in 2025. Once you start to approach age 50, you may want to consider long-term care insurance to potentially provide you with various care options available, as well as continuing to protect your assets. Once you reach your late 60s, the cost of obtaining long-term care policy may start to become prohibitive. There are a number of things to consider when it comes to the purchase of a long-term care insurance policy. A long-term care insurance policy can protect your assets, and it may allow you to reduce or avoid dipping into your portfolio to cover the cost of care, and again allows your funds to remain available for any legacy or charitable planning goals. In the event of long-term illness, long-term care insurance can provide an option to enable you to preserve your dignity. The policy could allow you to maintain your standard of living and your independence. As long-term care policies do have premiums, you need to make sure that you are comfortable with the cost of such premiums. It wouldn't make sense to pay premiums for a number of years only to let the policy lapse because of a strain on your budget in the future. Long-term care insurance can be complex, and policies offer a wide range of benefits for which they charge a wide range of premiums. It's critical to understand the nuances of the policy and/or to work with a professional who understands what to look for. You'll want to review and understand the limitations and features of the policy you're considering, such as a care threshold, maximum daily coverage, and lifetime benefit maximums. Ensure that you're taking a close look at the type of care covered in the policy. Long-term care policies can cover everything, but you need to understand exactly what is covered and what is not. Another feature to review is the waiting period parameters. Do you want your care to start right away when you become eligible, or wait a certain period of time? Many plans include a waiting, also called an elimination or deductible period, which is the amount of time before a long-term care policy will begin paying benefits, and it acts as sort of a deductible. You also may want to consider inflation protection. As we discussed, the cost of healthcare has been rising more rapidly than the general rate of inflation when looking at the Consumer Price Index. If you have decades between purchasing the policy and tapping its benefits, it may be important to you that your benefit keeps up with the rising costs of care. We recommend that you evaluate your options to pay for any extended care expenses you may experience. Let's talk briefly about estate planning. It may be considered a morbid topic of conversation, but it's a necessary one, especially when it comes to healthcare and your financial plan. To have a complete financial plan, a will isn't the only document you need to have in place. There are a whole host of documents that can help you pursue your estate management goals. And while we don't have the time today to cover every aspect of estate planning, there are a few documents that could be considered most important as it pertains to healthcare and your estate. In many states, the healthcare power of attorney and living will, the first two listed on this slide, are combined into the same document, typically called a healthcare directive. Individual states can have various power of attorney laws, and you will want to become familiar with your state's particular regulations in order to make a more informed decision. A durable power of attorney document can be effective as soon as you sign the document. All of these documents should be updated roughly every 5 years, even if those you've named and your decisions haven't changed. More and more institutions are starting to refuse documents that are older than 5 years, so it is very important to keep them up to date. Powers of attorney and healthcare directives apply during your lifetime, but they stop being valid the moment of death. That is when a will and/or a trust will take over. A trust has the ability to do a lot of the same things as a durable power of attorney during a person's lifetime, especially for those assets specifically owned by the trust. If you don't have these documents in place, would your family know your wishes? Advance directives are legal documents that provide instructions for medical care. And the great news is that contemporary research shows that we're trending in the right direction, with about 70% of older Americans having advance directives implemented before their death, which is up from only which is up from 30% only a decade ago. With extended life expectancy and a variety of treatment options available, the chance that you or someone close to you will benefit from an advanced directive is greater than ever. I want to thank you for joining me today as we discuss ways to incorporate healthcare into your financial plan. With that, let's open it up to some questions, Tom.
Yeah, we got a few of them here. Let's just start with the first one.
Great.
How do you plan for IRMA?
So IRMA, you're going to start planning now for in the future, because again, it's a 2-year look back. You can implement some of the strategies that we discussed earlier for reducing those Part B premiums. If you're already on Medicare, you're going to receive a letter annually from the Social Security Administration that talks about your IRMA, if applicable. If you find that your circumstances have changed within the last 2 years, you may want to file that form. And some of those things could be death of a spouse, work stoppage, change in pension, change in income producing policy, and you can submit that anytime after you receive the letter if you don't want to wait for that 2-year lag.
All right, next one here is a little bit of a situation, but I'll be 65 this year, but my husband is still working and we're still on his employer health plan. Should I start Medicare at 65 or stay on his corporate plan until he retires?
That's a great question that only you and your advisor could answer. But in general, it doesn't hurt if Part A is premium free to sign up for that while you have your employer coverage, because there's going to be primary and secondary coverage, which hopefully again will reduce potential out of pocket.
All right. I got another one here about IRMA. It's a popular subject here. When do I submit for relief from IRMA? I'm 66, recently retired, currently on COBRA, and about to enroll in Medicare Parts A, B, and D.
Wow, you're covering basically all of my slides there. But you can submit for IRMA basically at any time once the life-changing event has happened. Something to think about though is that you will need to submit documentation. So if you recently retired, you would need something from your employer that says you no longer work there. If unfortunately your spouse has passed, you would need that death certificate. You would need to prove that you have the life-changing event.
Okay, probably only got time for a couple more here.
Okay.
This next one, what are the benefits and cost effectiveness of COBRA versus the healthcare exchange to partially bridge the gap between retirement and Medicare?
Sure. Most often, COBRA is going to be the much more expensive option. The reason maybe to stay on COBRA, again, this is all down to your individual preferences, would be if there's a very specific plan benefit or a very specific provider in network that you can't find if you would go on the health insurance exchange and try to find some similar coverage. That could be, in general, the only time I would say that COBRA coverage may outweigh finding something on the exchange.
All right, and probably last question here. When should we start investing in long-term care insurance? I know you just recently covered it, but probably good to go over it once again.
Yeah, in general, it's never really too early to start looking at options, but when you're getting down to the nitty-gritty of really starting to buy and purchase the coverage, we usually say as you approach age 50 as a general rule. Once you get to the late 60s, costs can really become prohibitive, but there's never really an age where, that they won't take you. It's just the cost increases exponentially.
All right, well, I think that is all the time we have for questions for today. Chloe, thank you so much for joining us. And everyone, once again, this session is recorded, so look for the replay of that hitting your inbox either tomorrow or first thing Monday. And again, this will also be on our YouTube channel, so be sure to check that out. We've also got other webinar replays, lots of other good stuff there. So thank you again for joining. Chloe, thank you for being with us, and everybody have a great rest of your day.